Well, no one knows the cause, but millions of women know the hardship and the humiliation of a hormone nightmare that disfigures their bodies and torments their lives. Most victims suffer in silence. But as you're about to see, there is help out there.
I went a lot of years being misdiagnosed.
It's a condition many doctors can't diagnose and many sufferers have never heard of. Yet it affects up to 1 in 10 American women.
You don't really hear about it because we go to such extreme lengths to make sure we look normal. We don't look like the bearded woman at the circus.
Now the silence is being lifted as one woman decides to show it all to let other women know
you're not alone. This has been my biggest secret for 20 plus years.
It's a ritual Erlinda Cisneros has never shown anyone.
I wish this on nobody.
A time-consuming ordeal of stubble removal in places women aren't supposed to get hair.
This is what I call my drag queen makeup. I make fun a lot, I guess. Makes me feel better.
But it's no laughing matter.
It's my daily struggle. It's something that I have to deal with all the time.
For 20 years, Erlinda tried to get a doctor to help her, but was told repeatedly,
you need to lose weight.
Erlinda has company.
I was basically blown off by the medical community.
Stacy Marriott has also struggled with hair issues, plus, like Erlinda, irregular periods.
At one point, I actually bled for about 4 years straight.
She remembers asking a gynecologist for help. The response?
She just said it was my fault because I was fat.
Frequently, polycystic ovary syndrome goes undiagnosed for years.
Reproductive endocrinologist Dr. Ricardo Aziz is nationally recognized as the doctor of last resort for lots of women troubled by the mysterious symptoms of polycystic ovary syndrome, also known as PCOS. By the time they get to him, most have suffered for years.
They have excess hair growth, they may be infertile, their periods are irregular. Half of patients with polycystic ovary syndrome are overweight.
Dr. Aziz started treating Stacy for PCOS about 3 years ago. Erlinda was finally diagnosed late last year. She's now seeking help for her hair issues from cosmetic dermatologist Dr. Susan Evans.
So it sounds like you've tried pretty much everything to get rid of it.
Dr. Aziz explains PCOS is a hormone imbalance that, among other things,
involves excess male hormones in women,
which can trigger a whole cascade of problems in addition to the hair. Cysts on the ovaries are common and
they'll have a higher risk for having uterine problems, uterine bleeding, even uterine cancer.
As if all that weren't bad enough, Erlinda's learned PCOS has also impacted her blood sugar and blood pressure.
By age 50, I could have a heart attack.
A PCOS workup involves blood testing and an ultrasound of the ovaries to look for those telltale cysts. Treatment often starts with testosterone blockers and medication to make the body more sensitive to insulin.
Once I started to take all the proper medications, things are starting slowly to click back into place.
While her weight has started to drop and her cycles are now more regular, Erlinda is still struggling with hair, the PCOS issue that's bothered her the most.
It stopped me from doing all the things that I wanted to do because I was afraid of what people might think when they saw my face.
So just like every other woman,
yeah.
No woman would feel good about this.
After listening to Erlinda's story,
I know it's a tough thing.
Dr. Evans offered laser hair removal.
We're saying bye-bye to those hair follicles.
It'll be a few months before Erlinda will see the results. What she most looks forward to?
Having my husband touch my face. I want to feel like a woman when he touches my face.
We're going to follow up to see, Erlinda, how well the laser hair removal worked. Tomorrow we're going to take a closer look at Stacy and how PCOS contributed to her weight gain and what she did to finally get the weight off. Now, to learn more about PCOS and to find out where to get help, go to our website, myfoxla.com.